My name is Diego Trujillo. I'm the CEO of Las Vegas Heals. Thank you very much for taking the time to consider our clubs, to be able to expand your push and your career development within these young students. We know that teachers have a tremendous burden educating the younger population in a growing district, a growing population with more options. It gets harder and harder every day. As a CEO of a coalition of healthcare organizations, our goal is to make your job as easy as possible when it comes to career pathways into healthcare. We look forward to being able to work with you, to serve with you. We're always open to feedback, and if there's anything you can do, you can always reach out to me or Brianna Shaw, who is our program director here at the Heals Foundation. We look forward to being able to work with you and with your students and connecting them with the future of healthcare. Thank you.
One of the things that I was very excited for was that this was a student proposing a club idea that I hadn't seen before. I was very excited to get started. One of the main reasons was because when we did our student survey for my school, we had a lot of students that are interested in the medical field, and they don't always tell us that. So I wanted to bring that experience to my school to get that untapped potential from my students. The initial reservations I had was definitely time. Because I'm busy, I had a lot of things going on, but once I figured out what my schedule was like, then I was able to sit down and, rework it so I'd be able to fit a club like this inside my schedule to help my students.
For me, when I joined, I had honestly not had really many expectations because I didn't really even know what I was really getting into. I had just joined because I had heard that it was supposed to help you with your career in medicine. And honestly, it really helped me because I feel like in medicine, there's a lot of stories and superstitions surrounding it. A lot of people, as you grow up, just hear about big name doctors, or you just hear the word doctor or nurse, and you don't really hear about much else other than that. It's really kind of overwhelming in a sense because you never really realize the many careers that there are. And it just makes many people feel like they can't do it because of the vast amount of time and effort that you have to put into it. But realistically, I feel like medical society as a whole helped showcase the many things that you can do, and that even if you can't dedicate like 16 years to become a neurosurgeon, you can still do the many things. There are so many things in your power that you can do in order to join the healthcare system.
So the biggest difference I saw was the local networking of resources. Just the ability to have students talk with actual doctors and medical professionals that are in the community was a huge leap forward. A lot of times students don't realize that they have these resources in our community. So when they see it firsthand, they're more likely to want to pursue it or ask more questions and dig deeper into it.
I would tell them that if you want to be part of a group of people with shared interests as you, or even if you don't want that and you just want to hear more about healthcare in general, it's a really good place to go to. It can really give you different opinions on, honestly, a multitude of different aspects of healthcare. I know someone personally who wants to become a neurosurgeon, someone who just wants to be a phlebotomist and work that as a side job while working different things. It's really good to hear lots of different opinions and get different perspectives on healthcare as a whole.
I would say to any science or biomed teacher that they absolutely need to try the club. It's a different opportunity for them to expand the focus of what they learn in class, but also to see real world principles that students can learn not just from a book, but from actual people that live and breathe it every day. There are a lot of resources to help the teachers get started if they decide to do this club at the school, which I was very grateful for, the Constitution and the mission statements, the stuff that was already drafted. And then once we had those initial pieces, we were able to build from it and then go from there.
Thank you very much for your time and for your attention. We look forward to working with you and with your students and what we're able to do to make an impact here in Las Vegas towards a healthcare workforce pipeline. Thank you.